Okay, sir. 25-year-old female, air hostess by occupation, with complaints of fever, myalgia, fullness of ears and loose stools. Fever since 27/2/2022. After that, 3 days after, she has complaints of fullness of ears and loose stools, sir.
What are the possibilities that come to your mind? Common scenario in the wards.
Okay, sir. Fever, myalgia, loose stools. As sir, COVID era, for COVID should be ruled out, sir. Fever, myalgia, loose stools, sir.
Okay, viral disease.
Viral disease.
Viral fevers.
Viral fever, sir.
Okay, which includes COVID also, right?
Yes, okay, sir.
Any other differential diagnosis comes to your mind? Do you think this can be because of dengue?
Yes, sir. Dengue also possibly, sir. Fever, myalgia.
Okay, so anything is possible.
Yes, sir.
So, okay.
History of present illness. Patient developed high-grade intermittent fever associated with chills, severe myalgia. Later, she developed fullness of ears and nasal block, from which progressed to difficulty in hearing in both ears. One episode of loose stool, watery, not bloodstained or foul smelling, no history of abdominal pain, vomiting, dysuria, cough, altered sensorium, ear discharge or rashes. She was taken to local hospital as her fever was persisting and later referred to the hematology department, sir.
She is, okay.
Past history. He had chickenpox at the age of 15, jaundice at the age of 16, hepatitis A. Personal and menstrual history. Non-veg, regular bladder habits, occasional alcoholic with last intake on 26/2/2022. Non-smoker, menarche at 16 years, regular cycles. Travel history. She has a Delhi to Kochi travel till 2022 and residing at Chennai in a hotel from 2022. Drug history, no intake of furosemide for history of intake of furosemide for weight loss.
So what are the drugs used commonly for weight loss?
Sir.
Orlistat?
Orlistat, sir.
Orlistat. What is the problem with Orlistat? Orlistat produces continuous diarrhea if your food contains fat.
Okay, sir.
So they will become incontinent. So social embarrassment is common.
Okay,
so
sir.
You have to take absolutely fat-free food, which is sometimes not possible.
Sir.
Any other drug currently available for weight loss also used for treatment of diabetes and so on?
Metformin, sir.
And for any other drug?
SGLT2 inhibitor. GLP-1. Liraglutide, okay, sir.
Can be used, okay. Phentermine and topiramate are also drugs commonly used for weight loss. Glucagon and naltrexone is also used. I have not heard anybody using furosemide. Maybe
for weight loss.
But maybe some boxers or wrestlers who has to satisfy the criteria for weight belong to a particular category may be using. I do not know. But strangely enough, this patient was taking.
Okay, sir. General examination. Patient was conscious, oriented, febrile, dehydrated. No pallor, icterus, cyanosis, clubbing, lymphadenopathy or edema. Pulse of 96 per minute. BP 110/70. Respiratory rate of 16. SpO2 97% in room air. Temperature was 100 degree Fahrenheit. Systemic examination. CVS S1 S2 heart, no murmurs. Respiratory system, bilateral air entry equal. Normal vesicular breath sound. Per abdomen, soft, non-tender. No organomegaly. Bowel sounds were heard. CNS, higher mental function normal. Cranial nerve examination normal. No motor or sensory deficit. No cerebellar signs.
So in such a patient, what are the provisional diagnoses?
Sir, with the travel history, 24-year-old female with travel history with fever, myalgia, loose stools, Typhoid is a possibility, sir.
Very good. Typhoid is a possibility. Right.
Typhoid is a possibility.
And malaria present with diarrhea.
Malignant tertian malaria.
Falciparum.
Malaria, sir. Black water fever, sir.
Okay, unprotected. Okay. So you some social diagnosis. Can be dengue
Viral
fever?
Yes, sir.
UTI?
Yes, sir.
Abscess somewhere? Chills and rigor?
Yes, chills and rigor is there, sir. Leptospirosis also possibility, sir. Fever with. Yes, sir.
So leptospira is an important possibility. So on examination, in a case of leptospira, what are the important general examination findings that will give a clue to the diagnosis?
Sir, there will be conjunctival injection, sir. Conjunctival congestion will be there. Good. With calf tenderness will be there, sir.
Muscle tenderness. Anything on the skin? Anything on the skin? There will be ecchymotic patches.
Yes, sir. Yes.
And I may show jaundice.
Yes, sir. Jaundice with conjunctival congestion, sir.
If the general examination of enteric fever, what do you expect to look for specifically?
Coated tongue, sir.
Coated. Anything on the skin?
Skin that rose spot, sir.
Where do you look for it? Usually the trunk.
Okay, sir.
Okay, so you have a couple of differential diagnoses here.
Okay, sir.
So this patient was referred to hematology department from outside based upon these parameters.
Okay, sir.
These are the parameters they got and they said referred to. So what is your interpretation of this data?
With near normal HB, sir, with total count of there is leukopenia and bicytopenia, sir. Leukopenia and thrombocytopenia.
That's right. That's right.
With it's a possibility of infection because CRP is 135. With SGOT of 194, sir. Mostly viral etiology, sir.
Which are viruses can produce this bicytopenia?
Dengue, there can be bicytopenia.
Dengue is very good.
Dengue fever can cause.
What about the involvement of the liver?
Dengue transaminitis, sir. OTV.
That's possible. Very good.
Yes, sir. Dengue transaminitis.
So you have some. So since it was referred as to hematology, they are admitted here.
Okay, sir.
So they are
hemophagocytic lymphohistiocytosis, viral infections.
Why did they think like that? Because of persistent fever.
Persistent fever and bicytopenia.
Bicytopenia. So
yes, sir. Dengue, there should be after that acute phase, there should be rise in the platelet count, sir. There won't be persisting drop in the platelet.
The persistent drop after 1 week, they thought this is possible.
Okay, sir.
So after coming here, this is the investigation report.
Okay, sir. With lymphocytic predominant, sir.
Lymphocytic predominant, leukopenia continues.
Yes, sir.
Thrombocytopenia continues.
Continue with CRP. LDH also high, sir. Ferritin and LDH.
Enzymes are going up.
Yes, sir.
Procalcitonin above normal.
Yes, sir.
What about fibrinogen? It is low.
Triglycerides are
high.
High, sir. Ferritin also high, sir.
Yes. So what do you think?
So, sir, probable viral transaminitis, sir.
Viral transaminitis. Is this compatible with HLH?
Sir, with
this much high ferritin, triglyceride, bicytopenia, LDH.
Chances are there, sir.
Pardon?
Chances are there of HLH. Yes, sir.
That's right. Okay. So, yes.
Hemophagocytic lymphocytic.
Still possible.
Yes, sir.
Viral is still possible. You had rightly said dengue.
Yes, sir.
What about typhoid?
Typhoid is also a possibility, sir, because leukopenia is seen in typhoid also, sir.
Okay. So this patient was started on these drugs and
USG abdomen showing mild splenomegaly and multiple enlarged mesenteric and retroperitoneal nodes.
So typhoid fever was suspected. So this was sent. Dengue and leptospira was also investigated. So coming to typhoid fever, when do you send the vital test? What's the investigation choice for typhoid fever to confirm the diagnosis?
Vital test, sir.
Week 1, which test you do? First week you send for blood culture.
After that,
titers has to be looked for vital test. Third week you look for stool culture. And fourth
urine,
you look for
urine
culture. Okay. So that's sequence. So here it was sent second week. And because of the deafness, this investigation was also done.
Okay, sir.
So bilateral sensory hearing loss. And suspecting viral etiology, intrathemolytic steroids were given.
Okay, sir.
Patient showed improvement.
Okay, sir.
Meanwhile, CMV, IgM was negative.
IgG was positive.
And 2 are negative.
Okay, sir. Repeat blood shows platelet 90,000 with indirect hyperbilirubinemia with OTPT going thousands.
Again, went up.
Yes, sir. Okay, yes, sir.
Went up. This also went up.
Okay, sir. Ferritin also went up, sir.
This also went up.
Okay, sir.
So what do you think?
HLH, sir, mostly.
So blood culture was sent already, and this is what happens.
Salmonella typhi was been found, sir.
So what's the diagnosis now?
A typhoid fever, sir.
Oh, okay.
So the meropenem and doxycycline was discontinued, and the most choice of typhoid fever in ceftriaxone and azithromycin was started with the continuation of antivirals. Steroids were started for hearing loss. Fever spikes subsided after 2 days of ceftriaxone. Blood parameters improved. Hearing loss improved over a period of time.
So blood was repeated again.
Yes, sir. Repeated again and
starting typhoid fever. 19th of March, this was done.
Okay, sir. Everything comes to normal, sir.
And so on treatment, everything came normal. So what's the treatment of typhoid fever commonly?
Drug of choice is ceftriaxone, sir.
Anything else? Other drugs?
Ciprofloxacin.
That's good. Ciprofloxacin. Any other drug?
Ciprofloxacin.
Before ciprofloxacin all came into the market, what were the drugs used?
Azithromycin.
Azithromycin is a drug for multi-drug resistant typhoid.
Okay, sir.
Last choice. So to start with, it was chloramphenicol.
Chloramphenicol, sir.
Subsequently, ampicillin, amoxicillin. Then came chlorotrimmoxazole.
Okay, sir.
Then came ciprofloxacin and ceftriaxone.
Okay, sir.
Okay. So, what's the diagnostic criteria for HLH?
Fever more than 38.5 degrees Celsius, splenomegaly, peripheral blood cytopenia with at least 2 of the following: HB less than 9, platelet less than 1 lakh, absolute neutrophil count of less than 1000, hypertriglyceridemia of more than 265, or hypofibrinogenemia 150 mg per deciliter, hemophagocytosis in bone marrow, spleen, lymph node or liver, low or absent NK cell activity, ferritin more than 500, elevated soluble CD25. 5 out of 9 criteria should be positive.
So this particular patient had a fever,
Yes, sir.
hypertrophinia, hypertriglyceridemia, and ferritin is high.
Ferritin was high.
So what does it mean? And ultrasound showed splenomegaly.
Splenomegaly also was there, sir.
Okay. So symptoms and signs of typhoid fever.
Typhoid fever, abdominal pain, headache, chills, cough, myalgia, anorexia, nausea and vomiting, diarrhea, coated tongue, splenomegaly, relative bradycardia, and leukopenia.
So this patient had many of.
In this patient, we had fever with chills and myalgia, also diarrhea, splenomegaly, and also leukopenia was there.
Conspicuously, headache was absent.
Headache was absent.
That's right. Was absent, and there was no coated tongue.
And no nausea, vomiting.
Was not there. So, what are the common complications of typhoid fever?
Typhoid fever, it may go for ulcers, sir. Typhoid ulcers will be formed, and it may go for perforation, sir.
That's good. Can you tell what's the time of perforation, the natural history of the disease? End of second week.
Okay, sir.
End of third week is the time when it perforates. And what are the clinical evidences of perforation? Clinically, when we suspect perforation? The blood drops down.
Okay, sir.
The blood pressure suddenly drops down. Pulse suddenly goes up.
Yes, sir. Hypotension, tachycardia.
Patient deteriorates.
Yes, sir.
There may not be any evidence of rigidity or guarding.
Yes, sir.
Because the patient is very weak. And how to confirm your impression?
By ultrasound with the air fluid level, sir.
That's right. You can take X-ray in the right position to show gas on the diaphragm.
Yes, sir.
Of course, you have ultrasound these days to record everything. So complications can be in the abdomen, hemorrhage, perforation,
hepatitis, cholangitis, cholecystitis, and pancreatitis, sir.
There can be very bad hemorrhage, bad perforation, and there can be refractory diarrhea. Sometimes you get meteoris, others called as paralytic. So 4 intestinal complications are there. Any organ can get affected. Typhoid hepatitis is well known. This particular patient has got liver enzyme elevation. Okay. Thereby there is a amount of hepatitis going on. That is the preceding point in this case, that liver enzymes are very high.
Yes, sir.
And some of the neurological manifestations are also there.
Meningitis, GBS, neuritis, coma vigil.
Okay.
Other complications.
Yes.
DIC, hemophagocytic syndrome.
So, this case possibly had this
hemophagocytic syndrome, sir.
Okay. Then?
There can be hepatic or splenic abscess and granulomas, glomerulonephritis, endomyo and pericarditis, orchitis, pyelonephritis, HUS, severe pneumonia, arthritis, endophthalmitis, and parotitis. So, this particular patient is a classical typhoid, but he had atypical presentations. That's why all these confusions. Okay, sir. Okay. So, final diagnosis? Typhoid masquerading as HLH, sir. HLH, okay. Do you have any doubt about this case? Sir, what about that ear, sir? Why that there was hearing loss? There are few case reports where typhoid fever has produced deafness. Okay, sir. Okay. It's not given any textbook as a complication. Okay, sir. Viral fevers can also produce the same. Okay, sir. So there are some case reports only regarding the simultaneous involvement of the ear. Okay. We have no clue what it is. But when we got the culture report, we have to accept the diagnosis typhoid as the center point. Okay, sir. And incidentally, we found that she responded to the local steroid administration. Okay, sir. And
total recovery is the rule.
Okay, sir.
Any other doubt?
Sir, for a typhoid, how many? What is the course of treatment, sir? Ceftriaxone for how many days you have to give, sir?
All depends upon. At least
Okay,
you
sir.
7 days you must give at least.
Okay, sir. Okay, sir.
It depends upon what type of presentation and what type of complication this patient is passing through.
Okay, sir.
10 to 14 days is okay, very good. That will be enough for this patient.
Okay, sir. Okay, sir.
Commonly we give ciprofloxacin.
Yes,
If
sir.
patient is having serious situation, you can give ceftriaxone, either of it.
Okay. Okay, sir.
Azithromycin we have to reserve because multi-drug resistant type of typhoid
Salmonella.
very common, and that only you use this azithromycin.
Okay, sir.
Otherwise, azithromycin is not the best drug of choice.
Okay, sir.
The classical typhoid fever present with the fever, you have splenomegaly, hepatomegaly, toxic looking
Okay, sir.
patient.
Yes, sir.
Things are simple, straightforward. But this type of presentation with leukopenia and thrombocytopenia, with all this liver enzyme elevation and all, not very usual. But
Okay,
I have seen myself case of typhoid who are developing jaundice and aspiration. We got pus and it cultured salmonella typhi. So liver acts also due to salmonella is not uncommon.
Okay, sir.
Possible. Any organ can be affected with salmonella. Salmonella can produce very bad myocarditis and it used to produce death.
Okay, sir.
That's also not very common these days.
Okay, sir.
The new available to newer drugs, treatment of typhoid has become easier and better for us.
Okay, sir.
Yes. Any other doubt?